Tetanus. Even the name sounds ominous. It's a severe illness that most people don't think about often, but we should. Tetanus can have devastating consequences affecting our nervous system and even causing death. What makes tetanus even more frightening is that it's often preventable. Understanding this disease, its causes, and how to protect ourselves is crucial. The culprit behind tetanus is a bacterium called Clostridium tetani. This bacterium thrives in environments without oxygen, such as soil, dust, and animal feces. It's important to note that Clostridium tetani is incredibly resilient. It can survive in harsh conditions for extended periods, even years, waiting for the opportunity to infect. Understanding the nature of this bacterium is the first step in understanding how we can protect ourselves from the disease it causes. Clostridium tetani bacteria can't infect us through casual contact. They need an entry point, a gateway into our bodies. This gateway is usually a wound, even a small one. Cuts, punctures, burns, and even tiny scrapes can become entry points for these bacteria. Once inside the body, Clostridium tetani multiplies and releases a toxin. This toxin, called tetanospasmin, is incredibly potent. It attacks our nervous system, interfering with the signals that control our muscles. Section 4. Lurking in plain sight: common sources of tetanus. Tetanus is a serious bacterial infection that affects the nervous system, leading to painful muscle contractions, particularly of the jaw and neck muscles. It's often referred to as lockjaw. We often encounter potential sources of tetanus bacteria without realizing it. These bacteria are incredibly resilient and can be found in many common environments we frequent daily. Soil is a major reservoir for Clostridium tetani. This bacterium thrives in environments with little to no oxygen, making soil an ideal habitat. Gardening, working with soil, or even playing in the dirt can expose us to these bacteria. It's crucial to wear gloves and take precautions when handling soil to minimize the risk of infection. Dust particles, especially in older buildings or barns, can also harbor tetanus spores. These spores can remain dormant for years, waiting for the right conditions to become active. Animal feces are another common source. Farm animals as well as household pets can carry the bacteria in their intestines, which is then excreted in their feces. Stepping on a rusty nail, getting scratched by a pet, or even being bitten by an animal can introduce the bacteria into our bodies. Any break in the skin can be a potential entry point for the bacteria. It's important to remember that the rust itself doesn't cause tetanus. It's the bacteria that might be present on the rusty object. Keeping wounds clean and seeking medical advice promptly can help prevent infection. Section 5. Recognizing the signs, symptoms of tetanus. Understanding the symptoms of tetanus is crucial for early diagnosis and treatment. Tetanus symptoms are often unmistakable and can develop within days to weeks after exposure to the bacteria. Muscle stiffness, particularly in the jaw and neck, is a telltale sign. This stiffness is often accompanied by a sensation of tightness and discomfort. This stiffness can be so severe that it's difficult to open the mouth, hence the nickname lockjaw. Lockjaw can make eating and speaking extremely challenging. As the toxin spreads, muscle spasms and rigidity can occur throughout the body. These spasms can be painful and may last for several minutes. Other symptoms include fever, sweating, headache, and difficulty swallowing. These symptoms can make the patient feel extremely uncomfortable and weak. In severe cases, tetanus can affect breathing muscles, leading to life-threatening complications. Immediate medical attention is essential to manage these severe symptoms and prevent further complications. Section 6. Shielding ourselves: prevention through vaccination. Vaccination is one of the most effective ways to protect ourselves and our loved ones from various infectious diseases. The good news is that tetanus is highly preventable through vaccination. By getting vaccinated, we can significantly reduce the risk of contracting this potentially deadly disease. The tetanus vaccine, often combined with diphtheria and pertussis vaccines, DTaP or Tdap, is incredibly effective in protecting us. These combination vaccines not only shield us from tetanus, but also from other serious illnesses. Children typically receive a series of DTaP vaccines starting at 2 months of age, followed by booster shots. These early vaccinations are crucial in building a strong foundation of immunity. Adults should receive a Tdap booster shot every 10 years. This ensures that our immunity remains strong throughout our lives, providing ongoing protection. If you get a wound and it's been more than 5 years since your last booster, it's important to consult your healthcare provider. Your doctor may recommend getting another one to ensure you are fully protected. Staying up to date with vaccinations is a simple yet powerful way to safeguard our health.